Hey everyone, so I just wanted to go over some safety guidelines that we follow here at Iconic Health, and I encourage that if you are looking for a facility to treat at, that you kind of use this as a checklist to make sure that they're doing it as well. These are national safety guidelines given to us by UHMS, which most of us have our certifications from here at Iconic Health. The first one, number one, being hyperbaric is the practice of medicine. So there should be a prescription in your chart, and this protocol that you are doing should be written by a licensed provider, preferably somebody that is educated and trained in hyperbaric medicine. Number two, we use peri-hard-shell monoplace chambers, meaning that these are certified chambers by the FDA that they have cleared. And if a hyperbaric facility can't give you the name or brand or manufacturer of your chamber, that is something to watch out for. These chambers, when they're certified and cleared by the FDA, meet national fire, pressure, and safety. Number three, we perform chamber inspections daily and routinely, meaning before every patient goes into the chamber, we visually inspect that chamber and our pressure gauges, and we have guidelines that we follow daily and pressure checks and things that we do weekly at our facility. Number four, every person operating that chamber should have a certification to operate that chamber. So somebody random shouldn't be operating the chamber, and even if staff know about the chamber, there should always be a certified person operating your chamber. Number five, all staff, regardless of whether they're certified or not, are trained in emergency procedures at our facility, and we do regular drills to make sure everybody is prepared. Number six, anything flammable is strictly prohibited. So we send you a set of rules a few days before your procedure so you know what you can take in and what you can't. Every patient in our facility uses the scrubs that we provide to go into the chamber, so you will change when you get here. And all that clothing is certified 100% cotton and is certified to go into our chamber. You do not go in with your outside clothes. Number seven, leading into that, there are no static risk allowed in the chamber. So we put a grounding bracelet on everybody before they go into the chamber, and we close the door. Also, you can't take anything in with you. So rings, jewelry, smart watches, everything comes off. Eighth, our team monitors you continuously. So while you're in that chamber, there is always somebody in sight. We have mirrors in the front of the chamber if we have to step away to the oxygen and adjust that where we can see. We have cameras in the facility that also monitor the backside of the chamber so we can see if there's anything else going on, but somebody is always with you and monitoring you while you're in our chamber. Number nine, everybody in the facility is trained and handled and equipped to handle an emergency in the chamber. We've got a nice red folder that anybody could pop into and see exactly what they need to be done. That is a sign of a well-trained and kind of well-oiled facility to look out for if everybody knows the safety and emergency things that are in place in their facility. Number 10, we do a final chamber check before all of our patients go into the chamber, meaning we look one more time at safety things, make sure you've changed your clothes, make sure all your rings and your smart devices are off. There's no hidden cell phone in there. You'll typically in some things on social media see people on their laptops. That's not something you can ever take into the chamber. So we kind of do a final check to make sure you don't have anything still on you. As our last thing before you go into the chamber. So again, hyperbaric, 50 years, proven safety and efficiency. There can always be user error, but you want to find a facility that makes sure they check all the boxes and are very well trained and very well equipped to handle in a rare event and emergency. So if you have questions, let us know. We will post this below so you can kind of do your check if you're going to another facility to make sure they do all these things. Feel free to reach out if you have questions.